The moment we've all been waiting for. Open enrollment.
Hi everyone, Trudy Stucklick here. You're going to watch this film to the very end as it's going to help you drastically through open enrollment. And we're going to go over a couple of subjects that are going to save you money. Now, open enrollment is November 1st to December 15th. So you no longer need to stress over finding a plan for you or your family because there's agents like me out there that are going to help you navigate through the confusing health industry step by step. And with that, I'm licensed in 28 different states, so I can help you and your family get coverage and save you thousands of dollars. Every time I'm able to help somebody, it brings me so much joy. So these are a few Facebook reviews that you can see from my current clients. Now, Chloe Butler was a client who needed a plan within a couple of days, and I spoke with her and I helped get her on an amazing plan. But I'm gonna read off her review from the other day. I was in tears last week when I found out that my premium health insurance was going to start costing me over $1,000 a month. Not to mention that the deductible was $17,000. The very next day, I got connected with Trudy and things only got better from there. Thanks to her, my premium has been cut in half and my deductible is $0. Thank you so much for Trudy. So I just wanted to show you. Now you can feel free to go to my Facebook and be able to check out these on your own. So there are 4 main types of health insurance coverage. You have your employer plan, which are absolutely incredible plans. So those usually kick in around 90 days after working for an employer. And they will choose what they're going to pay towards your premium and your deductible. Those are absolutely incredible, except for when you add a spouse or kids, the premium and the deductibles normally skyrocket. So your next choice is the Affordable Care Act. Your ACA, your Obamacare plans. Now, those are good plans too if you qualify for Medicaid, meaning you're in a low-income household. So, meaning you would get government assistance with your monthly premiums and your deductibles. And for pre-existing conditions such as a heart attack, stroke, kidney failure, diabetes, those are absolutely excellent plans. Short-term plan. Now, you may ask why this lady is so upset. Well, you have to be careful. Become educated. Read the fine print, as you need to be aware, as an agent may tell you how excellent this plan is because the premium's low. Well, it's an indemnity plan, meaning that every 3 to 6 months it renews. You better hope and pray that you don't have a bad accident because now that's a pre-existing condition and they do not have to renew you. Also, the prescription coverage is not covered in most of these plans. Now, as far as if for some reason you don't get renewed, now you're outside of open enrollment, so you're kind of stuck. So they're really good plans because if you're in between jobs, that's the only thing they were really designed for. They're definitely not a full coverage plan like the other options on here. Okay, private market plans. As you can see right here, you can see with the little piggy, you're saving money. This is by far what I recommend the best option. With these plans, they are medically underwritten, so you do have to be healthy to get onto these, but they will save you the most monthly premiums and the most yearly deductibles. Here's an example of an ACA Obamacare plan. This is for an individual and this is for a family. So what's a premium? That's what you're going to be paying monthly. Also, your carrier. That's going to be the insurance company that you're working with. Now, the network, which is an HMO, PPO, EPO. That's what determines which providers you can see as far as doctors, pharmacists, hospitals, and specialists. What's your max out of pocket? That's going to be the most you'll have to pay for healthcare during your coverage period, which is normally a 12-month increment. Also, your deductible. That's going to be the total amount you'll pay for your healthcare services before your insurance starts to pay a portion of the costs. What is your network? HMO, PPO, EPO. HMO, Health Maintenance Organization. You're restricted by your district, your county, and your zip code. Also, you need to get a referral by a doctor before seeing a specialist. EPO, Exclusive Provider Organization. Outside care of network is normally not covered. Also, it's higher deductibles. PPO, nationwide coverage with a network of doctors that have agreed to provide care up to the plan members at a certain rate. Plus, there's no referrals that are needed, and it's highly recommended as it's the most savings. With everything going on with COVID right now, you may have lost your job, and you may have been offered Cobra, which is an extension of your employer's insurance. With those extensions, the premiums normally increase by 102%, as your employer used to pay that portion. Or, say you're renewing your current health insurance for the year. Right now is a great time to utilize open enrollment and shop around to see, because your costs may have increased or decreased. So, Trudy Stucklick here, and I'm here to help. Go ahead and reach out, discovernewhealthplans.com, or reach me directly through text or call at 248-491-3281. Thank you so much, and have a blessed day.
What's here before you already know it? Open enrollment.